Hello. After technical difficulties, we're back in business. I apologize for the fonts. I promise UX folks, this is not the font I actually used. So my name is Busra Demirci, and I'm a senior user experience designer at Modernizing Medicine, a healthcare technology company where we're trying to revolutionize the face of healthcare. Disruption. What do you think of when I say this word? Disruption defined is a disturbance or problems that interrupt an event, activity, or process. By definition, it has the word problems in it. But most people don't associate the word disruption with problems. We associate it with solutions. In the tech industry, mainly, through revolutionizing industries and shaking technology holistically. All of us today are disruptors in our very own way. And such advances in technology are specifically needed in the healthcare industry. And technology is revolutionizing how healthcare is consumed, but it's more focused on the efficiency of the system, not so much on the patient. And at Modernizing Medicine, we are changing that because patients are saying, I really want something that's gonna help me, and we're listening. So I want to take you on a journey of a shelf that I'm sure you have all seen at some point in your lives. During my research, I encountered this shelf a lot more than I would have expected. I was very, very surprised to see that a lot of practices are still following the antiquated process of using paper. And this often takes over 30 minutes for the patient and over 20 minutes for office staff to actually transcribe back into the system. So as you all know, patients come in many varieties and age ranges, anywhere from the age of 9 all the way to over 90. But today I want to focus on a specific persona that stood out to me the most and that we used as our North Star on this journey, and that is Mary Alice. Mary Alice is wanting to understand everything that her doctor tells her. And during my contextual inquiry, I encountered Mary Alice many times. The problem is she has a hard time remembering. She pulls out a magnifying glass just to read all of the small writing that's on a piece of paper. Her hands ache as she tries to fill out every single chart that was provided to her. She carries a bag full of her medications because she can't always remember how to spell them or what their names actually are. So we wanted to make Mary Alice have a more pleasant experience. And we did this by allowing her to understand what goes on in her medical history, by giving her a more streamlined way to enter information into a system and to communicate with her provider. At Modernizing Medicine, we try to follow a user-centered design process. And I'm sure you all try to follow that as well. But the discovery phase for us is one of the most important phases because in healthcare, there's so much minutia that a lot of us are not familiar with. And we need to make sure that we document and observe each of those phases. What we then do is we move into the ideation phase and design phase, where we still collaborate with end users and then validate with them when we're done, and cyclically iterate until we actually perfect what we've accomplished. And for this specific project, we were able to create the patient kiosk. The patient kiosk is a native iPad application that allows patients to seamlessly enter a doctor's office and enter their medical information and look through exactly what they have on file and record and communicate that back to their doctors in an easy and efficient way. During our discovery phases, we followed Mary along and noticed that a lot of offices are still using paper, as mentioned earlier. But this was causing a gap in communication between the front and the back office, and it was becoming very cumbersome on both ends. So Mary's journey was a ebb and flow of getting really excited that she's about to see her doctor and understand what her healthcare regimen was, but then having to wait in a really long line. And we wanted to make sure that we fixed this. We started with an open card sorting exercise where with multiple, maybe like over 50 patients, we had them structure the information in a way that they would naturally want it to flow and see when they're interacting with an application, so that we cater to their mental model of how that is displayed. We used information architecture diagrams to communicate with stakeholders and create a code architecture that was sustainable and scalable for our internal team. We then conducted internal design sprints with multidisciplinary teams, all the way from product managers to quality assurance engineers to iOS developers and UX folks alike. We got everyone really excited because at the end of the day, I think being a patient is something we can all empathize with. And while we created our prototypes and our first phases of development, we made sure that we did usability testing sessions. I've traveled to a lot more doctors' offices than I would have expected, and one common thread that I noticed, even when I observed various demographical regions within the United States, is that everyone is ultimately looking for the same solution. So our solution allowed people like Mary, who have a hard time remembering and, for example, can't remember their username and password to a system, can easily authenticate their identity using a secure system that we built on the back end. We integrated a conversational UI so that it didn't feel like she was interacting with a system. It felt like she was talking to someone. We provided her with interactive elements so that she was engaged as she went through and populated her information. We gave her intuitive ways to actually denote things throughout her medical record and patient chart. And the results have been great. We have gotten 58% of our patients have rated the application a 5, and about 21% have rated it a 4. And I actually checked the records last night, and our oldest patient to date is 101 years old. She's from Tennessee, and she rated it a 4. So I think that's a success. And we've actually been getting really great feedback from our, practices that are utilizing the product. They're saying that patients are responding to it very well, and they're able to save at least 10 to 15 minutes per patient. And for a small to mid-level practice, that's about 2 hours of time per day, not having to transcribe, not having margin of error, and being able to effectively communicate with their patients. And Kiosk is just one part of that ecosystem. We see the future of healthcare as a holistic, continuous, and seamless experience for both the patient and the doctor, so that they don't have to think when they go into a medical practice, that they can actually interact with their provider, which is the reason why they got there in the first place. And let me show you what that means.
Ever wonder how you could improve your patient's experience and better streamline your office? With our exciting future enhancements to patient workflow, a more streamlined and patient-centric office is just a few taps and swipes away. The enhanced workflow all begins with a smart device, in this case, a beacon. The beacon syncs with modmed Patient, our innovative patient portal, on the patient's Apple or Android phone. This triggers a notification in which the patient can log into the modmed Patient application with simply their fingerprint. By logging into the portal, the patient is both automatically checked into the practice management system and is also placed in the waiting room inside Office Flow. Modmed Kiosk and modmed Patient then sync and automatically log the patient in. The patient easily updates medical information and signs waivers using the kiosk. After the patient completes their medical history and waivers using the kiosk, the application will trigger a call button inside Emma. notifying the appropriate staff member based on the appointment in practice management. The kiosk can save an average of 10 to 15 minutes per new patient, and it can also save the staff an average of a few minutes per patient too. As the patient enters the exam room, another beacon will sync and update the patient's exam room inside Emma's office flow. Once the medical assistant walks out of the exam room, it triggers a call button, alerting the doctor that the patient is ready to be seen. The beacon then syncs with Emma, and the timer begins. Much like you would talk to Siri or Alexa, voice commands from the physician signal a completed patient visit.
Emma, patient is done.
The timer inside Office Flow stops automatically. A message cues the patient to visit the kiosk or the front desk to confirm their next appointment and pay the bill if needed. Finally, when the patient is checking out and paying for the current visit, Kiosk will automatically sync with Emma and clear the exam room the patient was just in. The future of healthcare is evolving. With these tools and our innovative suite of solutions, revolutionizing patient and staff workflow is just one more way we're helping to bring efficiency to your practice.
Thank you. I do think we have a few minutes for questions, so if there are any questions, I'm more than happy to answer. Yes. Yes, so we own the entire ecosystem. Our flagship product was actually the first native iPad EHR system that was built. We started off building an EHR system. We then expanded into a practice management system. We also have, big data and other applications, and now we have a whole suite of patient products as well. Yes. Yes, so the question was, how would a patient transfer her records to another hospital? So our solution is specialty specific. So any doctor can easily communicate to another specialty doctor. And if they needed to transfer it to a hospital, we use what's called a CCDA to communicate that information via XML. All right, thank you everyone.